let me discuss the next important drug, that is rimonabant. So, if you see this rimonabant, it is a cannabinoid type 1 receptor antagonist. Right, it is a cannabinoid type 1 receptor antagonist. Okay, so that is your rimonabant. And this rimonabant, actually it is developed for smoking cessation, right? So in order to stop smoking, for smoking cessation, this rimonabant has been developed. But this will also facilitate the weight loss. Right, this will also facilitate the weight loss. And this rimonabant, it is initially used in patients with BMI more than 30 kg per meter square. Right, it is used, or it is initially used in patients with body mass index of more than 30 kg per meter square. And what are the frequent adverse effects of this rimonabant? The frequent adverse effects of this rimonabant, most notably, this will cause severe depression. Right, most notably this will cause the severe depression, and because of this severe depression, this has risk of suicidal tendency. Right, this has the risk of the suicidal tendency, and this particular drug is no longer used clinically. Right, it is no longer used clinically. So this is about your rimonabant. Then followed by this rimonabant, we have another newly approved drug by the FDA, that includes Lorcaserin. So if you see this Lorcaserin, it is a serotonin 2C receptor agonist. Right, it is a serotonin 2C receptor agonist, and this Lorcaserin, it selectively activates the serotonin 2C receptors in the brain. Right, it selectively stimulates, or it selectively activates the serotonin 2C receptors within the brain. Now, because of the selective activation of 2C receptors within the brain, this will promote the satiety. Right, this will promote the satiety. So, where is this Lorcaserin indicated? This Lorcaserin, it is indicated as an adjunct to low calorie diet. So it is not just you need to give Lorcaserin which will promote the weight loss. Along with the low calorie diet, right, along with low calorie diet, this Lorcaserin, right, this Lorcaserin, it is given as an adjunct, right, to a low calorie diet. And along with the low calorie diet, there should be also increased physical activity. Right, there should be increased physical activity. Then at which particular BMI this Lorcaserin is indicated? Lorcaserin is indicated when the BMI of the individual is more than 30 kg per meter square. Right? So this is the indication for the Lorcaserin. Or for suppose if the BMI of the individual is more than 27, and along with that if the individual has weight related comorbid conditions, right, if the individual has developed weight related comorbidities, right, what will be the obesity related comorbidities? I have discussed that in detail in the features of the obesity. So this Lorcaserin should be given when the BMI of the individual is more than 30 kg per meter square, or when the BMI of the individual is more than 27 kg per meter square, and along with that if there is weight related comorbidities, you need to give this particular Lorcaserin. And the dosage of this Lorcaserin is 10 milligrams twice daily. Right, the dosage of this Lorcaserin, it is 10 milligrams twice daily. Now, what will be the adverse effects of this Lorcaserin? Right, what will be the adverse effects of this Lorcaserin? The adverse drug reactions of the Lorcaserin, it includes headache, dizziness and fatigue. Right, headache, dizziness and fatigue. Then followed by that, this particular Lorcaserin also causes nausea, dry mouth and constipation. Right, nausea, dry mouth and constipation. And apart from that, this particular Lorcaserin also causes backache and cough. So these are the adverse drug reactions of this Lorcaserin. So in order to have a short recap, if you see this rimonabant, it is a cannabinoid receptor type 1 antagonist, and it is mainly used for the treatment of smoking cessation, but it also facilitates the weight loss of the individual, and it is indicated mainly when the BMI of the individual is more than 30 kg per meter square. And the adverse drug reactions of this rimonabant is that it will cause severe depression, and thereby the individual develops the suicidal tendencies, and that is the reason why this is no longer used. And if you take this Lorcaserin, it is the new FDA approved drug, and this Lorcaserin, it is a serotonin 2C receptor agonist, and this selectively activates the 2C receptors which are present within the brain, and thereby they will promote the satiety. And it is indicated mainly when the BMI of the individual is more than 30 kg per meter square, or when the BMI is more than 27 kg per meter square, and along with that if the individual has weight related comorbidities, this Lorcaserin is indicated. And if you see the adverse effects of this Lorcaserin, it includes the headache, dizziness and fatigue, and these individuals will also develop nausea, dry mouth and constipation, backache and as well as cough. And this Lorcaserin, it should be given as an adjunct to low calorie diet, and it has to be given as an adjunct to increase in the activity of the individual. So this is about your Lorcaserin. And another important adverse effect of Lorcaserin is that it will also cause hypoglycemia. Right, another important adverse effect is it will also cause the hypoglycemia. Now, having said about or having discussed about this Lorcaserin, the another new FDA approved drug for the treatment of obesity is Phentermine and Topiramate ER. Let me discuss that particular combination of Phentermine and Topiramate ER. So, let me discuss the next important drug in the treatment of obesity, that is 𝐒𝐮𝐬𝐜𝐫. So, if you see this 𝐒𝐮𝐬𝐫, it is a combination of Phentermine and Topiramate ER. Right, it is a combination of the Phentermine and as well as the Topiramate ER. That is what is your 𝐒𝐮𝐬𝐜𝐫. Now, out of this, if you see the mechanism of action of these particular drugs, so topiramate, the precise mechanism is unknown. Right, the precise mechanism is unknown. Whereas, if you see this phentermine, it mediates the release of catecholamines in the hypothalamus. Right, it mediates the release of catecholamines in hypothalamus. Right, mediates the release of catecholamines within the hypothalamus. Now, because it mediates the release of catecholamines within the hypothalamus, what these catecholamines within the hypothalamus does? These catecholamines within the hypothalamus reduces the appetite. Right, these catecholamines within the hypothalamus reduces the appetite and it decreases the food consumption. Right, it decreases the appetite and it also decreases the food consumption. So, that is what is the mechanism of action of your phentermine. And what is the dosage of these particular drugs? The dosage of this phentermine and topiramate, it is, you need to start at 3.75 milligrams of phentermine right, you need to start at 3.75 milligrams of the phentermine, and topiramate you need to start at 23 milligrams daily. Right, you need to start at a dosage of 23 milligrams daily. And this particular combination of 3.75 milligrams and 23 milligrams daily, it has to be given for nearly around 14 days. Right, it has to be given for nearly around 14 days. And from this particular dosage of 3.75 milligrams and 23 milligrams daily, you need to increase the dosage of this 𝐒𝐮𝐬𝐜𝐫𝐢𝐛𝐞 to 7.5 milligrams and 46 milligrams daily. Right, exactly the double dose. Okay, so you have to increase these particular dosage to 7.5 milligrams or like 46 milligrams once daily, and you have to give this particular drugs for nearly around 12 weeks. And after 12 weeks, right, after 12 weeks, if the weight loss is less than 3%, right, if there is less than 3% weight loss, then you need to discontinue this, right, then you need to discontinue this 𝐒𝐮𝐬𝐜𝐫𝐢𝐛𝐞. So this is about your combination of phentermine and as well as topiramate. Then followed by that, the next important thing you need to know is the adverse drug reactions of this 𝐒𝐮𝐬𝐜. So the adverse drug reactions of 𝐒𝐮𝐬𝐜 is that they will cause paresthesias. So paresthesias is that like abnormal sensation within the extremities, right, where you have tingling and numbness, or where the individual will have burning sensation within the extremities. So that is what is your paresthesias, and these individuals can also have dizziness, and there will be also decreased sleep, that is insomnia, right, there will be decreased sleep, that is insomnia, and they will also have constipation and dry mouth, right, they will also develop constipation and dry mouth. So this will be the adverse drug reactions of this particular combination phentermine and topiramate, which is nothing but your 𝐒𝐮𝐬𝐜. So what exactly is the mechanism of action of topiramate is not known, but if you take phentermine, this will mediate the release of catecholamines within the hypothalamus, And these catecholamines which are released in the hypothalamus, they will decrease the appetite of the individual and they will also decrease the food consumption of the individual. And the dosage of this 𝐒𝐮𝐬𝐜 is you need to start at 3.75 milligrams or 23 milligrams daily. So phentermine 3.75 milligrams and topiramate 23 milligrams daily you need to start, right? And after 14 days, you need to double this particular dose to 7.5 milligrams phentermine and 46 milligrams the topiramate. And after 12 weeks, if there is less than 3% weight loss, you need to discontinue this drug. And the adverse drug reactions of 𝐒𝐮𝐬𝐜 is, it will cause paresthesia, dizziness, insomnia, there is decreased sleep, constipation and as well as the dry mouth. Now, after having discussed about this combination of phentermine and topiramate, another newly approved drug by your FDA is Naltrexone and Bupropion. Let me discuss about this Naltrexone and Bupropion. So, the other important combination which have been approved for the treatment of obesity is Naltrexone and Bupropion. So, this Naltrexone and as well as the Bupropion, this is available as a drug called Contrave. Right, this is available as a trade name called Contrave. Now, what is the dosage and schedule of this Naltrexone and as well as the Bupropion? So, in the first week, right, in the first week, you need to give 1 tablet in the morning. Right, you need to give 1 tablet in the morning. And in second week, you need to give 1 tablet in the morning and 1 tablet in the evening. So, week 2, you need to give 1 tablet in the morning and 1 tablet in the evening. Then week 3, you need to give 2 tablets in the morning and 1 tablet in the evening. Right, 2 tablets in the morning and 1 tablet in the evening. That is week 3. Then if you take week 4, right, if you see week 4, you need to give 2 tablets in the morning and 2 tablets in the evening. Right, 2 tablets in the morning and 2 tablets in the evening. So, this will be the schedule of this Naltrexone and as well as Bupropion. So, you need to give for at least 12 weeks. Right, you need to give for at least 12 weeks. After 12 weeks, if there is less than 5% weight loss, right, if there is less than 5% weight loss, then you need to discontinue this particular drug. Right, you need to discontinue this Naltrexone and Bupropion. Now, if you see the mechanism of action of this Naltrexone and Bupropion, these drugs, they have the effect on 2 separate areas of the brain. Right, they have the effect on 2 separate areas of the brain. And what are those 2 separate areas of the brain? They include hypothalamus and mesolimbic dopamine circuit. Right, the effect is on hypothalamus and mesolimbic dopamine circuit. Right, this is the site at which the effect of naltrexone and bupropion is being present, and what exact neurochemical effects is not known. But if you take the adverse drug reactions of this naltrexone and bupropion, they will cause nausea and vomiting. Right, they will cause nausea and vomiting. And along with that, these particular drugs also have the adverse effects of headache, dizziness and insomnia. Right, headache, dizziness and insomnia. Right, so insomnia in the sense where there is reduced sleep within the individual. And these drugs will also cause dry mouth and constipation. Right, these drugs will also cause dry mouth and constipation. And this particular combination of naltrexone and bupropion, they have the potential to cause suicidal thoughts and behavior. Right, they have the potential to cause suicidal thoughts and behavior. Right, they have the potential to cause the suicidal thoughts and behavior. So this is about the naltrexone and as well as the bupropion. So naltrexone and as well as bupropion, it is available as a trade name, that is Contrave. And the schedule of this naltrexone and bupropion is that on the first week you need to give 1 tablet in the morning. On week 2 you need to give 1 tablet in the morning and 1 tablet in the evening. Week 3 you need to give 2 tablets in the morning and 1 tablet in the evening. And week 4 you need to give 2 tablets in the morning and 2 tablets in the evening. And after giving this particular naltrexone and bupropion for 12 weeks, if the individual has less than 5% weight loss, you need to discontinue this drug. And the mechanism of action of this naltrexone and bupropion is that it acts on 2 separate areas of the brain, that is hypothalamus and as well as mesolimbic dopamine circuit. And what exact neurochemical mechanism is not known. The adverse drug reactions of this particular naltrexone and bupropion is that they will cause nausea and vomiting, headache, dizziness, insomnia, dry mouth and constipation. And this particular drug, it has the potential to cause suicidal thoughts and the suicidal behavior. So this is about your naltrexone and bupropion. And the next important drug like what we have is liraglutide. So liraglutide is another newly approved drug for the treatment of the obesity. Let me discuss about this liraglutide. So the next important drug is liraglutide. So if you see this liraglutide, it is a glucagon-like peptide 1 receptor agonist. Right, it is a glucagon-like peptide 1 receptor agonist. So this is liraglutide. And where is this particular liraglutide being used? This liraglutide, it is used in the treatment of type 2 diabetes mellitus, and it is also being used as anti-obesity drug. Right, it is used in the treatment of type 2 diabetes mellitus, and it is also being used as an anti-obesity drug. Now, this liraglutide, the route of administration is subcutaneous route of administration, and in the treatment of diabetes mellitus, it is being administered subcutaneously once weekly. Right, once weekly. And it is also being used as an anti-obesity drug. And this liraglutide, it is a physiological regulator of the appetite. right? It is a physiological regulator of the appetite and as well as the calorie intake. Right, it is a physiological regulator of the appetite and the calorie intake. So, it will reduce the appetite of the individual and it will also reduce the calorie intake of the individual. Now, where are these GLP-1 receptors being present? These GLP-1 receptors these GLP-1 receptors, they are present in the several areas of the brain regulating the appetite of the individual. Right? These GLP-1 receptors, they are present in the several areas of the brain regulating the appetite of the individual. And what is the dosage of this liraglutide for the treatment of obesity? It has to be given 3 milligrams subcutaneously. Right? It has to be given 3 milligrams subcutaneously. Now, what are the adverse drug reactions of this liraglutide? Liraglutide, it can cause hypoglycemia, right? As such, it is used in the treatment of type 2 diabetes mellitus. But if the dosage of liraglutide is being increased, or if the individual does not take adequate quantity of the food after taking this liraglutide, the individual can have the development of hypoglycemia. And there will be also development of nausea and vomiting. Right? Development of nausea and vomiting. And along with that, the individual will also develop constipation and dyspepsia. Right? Constipation and dyspepsia. And this liraglutide, the another important adverse drug reactions include fatigue and dizziness. Right? Fatigue and as well as dizziness. And they will also cause pain abdomen. Right? They will also cause the pain abdomen. So, these are some of the very important points related to your liraglutide. And we have some new drugs which have been approved in the year of 2015, that is beloranib. Right? The new drug is beloranib. So, this is the new drug which has been approved for the treatment of the obesity, and that has been approved in the year 2015. So, let me have a short recap on this liraglutide. Liraglutide, it is a GLP-1 analog, and this GLP-1 analog, it is used in the treatment of diabetes mellitus, and it also has the anti-obesity effect. Right? It will reduce, or it is a physiological regulator of appetite and as well as the calorie intake. And this GLP-1 receptors, they are present in the several areas of the brain. And the dosage of this liraglutide is 3 milligrams and it has to be given through subcutaneous route. The adverse drug reactions of this liraglutide, it includes hypoglycemia, nausea, vomiting, pain abdomen, constipation, dyspepsia, fatigue and as well as dizziness. And the other important new drug which has been approved is beloranib. Right? So, these are the medical management drugs, or these are the drugs used in the treatment of the obesity. Now, if the BMI of the individual is like more than 40, right, where the individual is having severe obesity, then you need to advise the bariatric surgery. So, let me discuss the surgical treatment of the obesity. So, when the BMI of the individual is more than 40, right, which we call it as severe obesity, and there is failed medical management and failed lifestyle modification, then the individual has to undergo the bariatric surgeries. Right, the individual has to undergo the bariatric surgery. So, this bariatric surgery, this is the most effective long-term treatment for obesity. right? This is the most effective long-term treatment for obesity. Several approaches are being used, and all of these approaches are being performed laparoscopically. Right, all of these approaches are being used laparoscopically, and the goal is that to mainly disrupt the release of renin and other peptides, and thereby enhancing the satiety within the individual. Now, what are these various approaches which are being done? Number one, vertical banding gastroplasty. Right, so this is one of the approach laparoscopically in the bariatric surgery, and another approach is 𝗠𝐴𝐻 bypass, and then laparoscopic banding of the stomach. Right, laparoscopic banding of the stomach. So these are the various approaches which are being done laparoscopically, and these are the most effective long-term treatment, right, used as the bariatric surgery. And complications, definitely yes, the post-operative complications you need to take care. So this is about the treatment of obesity. So if you go through the entire session, like we have discussed, like what are the various forms of the obesity, right, and then we have discussed classification of the weight of the individual with the body mass index. Then we have discussed the pathophysiology of development of obesity. So very important point in the pathophysiology is that what are the neurotransmitters which will increase the appetite and what are the neurotransmitters which will decrease the appetite. So that particular slide is very, very important. Then followed by that, in the treatment we have lifestyle modification, medical management, and then surgical treatment. So this completes the discussion of this very important topic, that is obesity.